We're going to demonstrate the cardiovascular assessment. First, I'm going to ask my patient some questions and then complete the assessment. Sir, have you had any recent chest pain?
No.
Have you had any shortness of breath?
No.
Have you had any unexplained fatigue or weakness?
No.
Okay, first thing I'm going to do is I'm going to auscultate your heart sounds. I'm going to listen with both sides of my stethoscope. We'll first do it in the supine position, followed by a left lateral position. So I'm listening to heart sounds. Initially, we're listening for the aortic valve. We're listening to the aortic valve, second intercostal space, right sternal border. We'll then move over to auscultate the pulmonic valve, which is the second intercostal space, left sternal border. We'll move down to the fourth intercostal space, left sternal border, to auscultate the tricuspid valve. And finally, we'll move down to the fifth intercostal space, left midclavicular line, to auscultate the mitral valve. I initially auscultated with the diaphragm. Now I'm going to flip it over and auscultate with the bell. Same positions. Second intercostal space, right sternal border. Second intercostal space, left sternal border for the pulmonic valve. Fourth intercostal space, left sternal border for the tricuspid valve. And fifth intercostal space, midclavicular line on the left side for the mitral valve. So as I was auscultating these, I noted that S1 and S2 was present, and there was no S3 or S4 abnormal heart tones. All right, so if you turn to your left side, we're going to do the exact same assessment with the patient in the left lateral position. So again, second intercostal space, right sternal border. Second intercostal space, left sternal border. Fourth intercostal space, left sternal border. And fifth intercostal space, midclavicular line. That was with the diaphragm. We'll repeat the exam with the bell of the stethoscope. Again, hearing S1 and S2 and no S3 or S4 heart sounds were present. All right, if you'll turn back onto your back for me. Now we're going to palpate bilaterally your carotid arteries, and then we'll auscultate them. We're looking for the carotid arteries to be elastic with no thrills noted when we listen. Two plus carotid artery on the right. Two plus as well on the left. All right, the carotid arteries were noted to be elastic with no thrills or bruits noted upon auscultation. All right, so now we're going to palpate the pulses. So we're going to start off with palpating the radial pulses bilaterally. These are noted to be strong, regular, and 2+. We'll move up to the brachial pulses bilaterally. Again, also noted to be 2+, regular. If you bend your leg slightly, we'll palpate the popliteal pulses. Also noted to be 2+. Move down to palpate the posterior tibial pulses. Also noted to be regular and 2+. And then finally the dorsalis pedis pulses. Also noted to be 2+. And that's the completion of the cardiovascular assessment.